Very good afternoon to all of you, and thank you, Dr. Jagani, for a nice introduction. And in some connectivity problem, the picture is not visible. Anyhow, I would like to make myself as approachable as possible through my slides. So, lipid lowering nutraceuticals in clinical practice is basically age-long, practice which is being here in India for centuries together. Only the new thing that we have added is a scientific approach as well as the utilization of this nutraceutical in evidence-based medicine. But most of the people know that our forefathers or our grandparents, they always tell us that take this to be cured. So now going ahead, my presentation, I like to have a brief introduction to lipids, its synthesis, and of course, the utility of these nutraceuticals in clinical practice, which is the topic for today. Now, to introduce the lipids, triacylglycerides as fuels, like glycerophospholipids in membrane are present in every cell. Prostaglandins are signal used to most of the hormones and anyway otherwise intermediary metabolism to many um, reactions in human body as well as animals. Cholesterol and its derivatives are necessary for steroid synthesis and survival for human being. Now, fatty acids are the opposite of beta oxidation in the sense that two carbon acetate units are linked to form even chain saturated fatty acids. They differ from fatty acid degradation basically. They being in cytoplasm, not in matrix. Acyl carrier protein rather than enzyme A. The enzyme is in a complex and utilizes NADPH. So they are the biochemical aspects of these lipids basically. Acetyl coenzyme carboxylase requires ATP for the synthesis of these molecules. Now coming to coenzyme carboxylase in this regulation, there is a strict control of fatty acid biosynthesis. Step local hormonal and gene regulation. This is involved in regulation of beta oxidation. When fuel is high, acyl coenzyme is plentiful. Malonyl coenzyme is produced basically. Malonyl coenzyme may
Ravikaant, Dr. Ravikaant, can you just click on the slides so that it can be visible as a full screen?
Okay,
because audience are repeatedly requesting that full screen slides should be there.
Right.
So
Is it visible? Is it visible now? Yeah, is it visible? Hello. 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 Hello, Doctor.
yes.
So, Mr. Ashtar, is it visible? Slides are visible or not?
Slides are visible, but we
Some
can't
fonts are.
read anything.
Okay, I think I have to go back to my.
Okay.
Is it visible now?
Yes. Now it is visible.
Okay, fine. Thank you. Thank you very much. So a brief introduction about the fatty acid synthesis. I have told you in brief, acyl coenzyme carboxylate and its regulation is basically a strict controlling mechanism for fatty acid synthesis at key step level, and transfer to acyl carrier protein is mandatory for synthesis of malonyl coenzyme A. I've already told you that when person is eating normally, there is plentiful of malonyl and other molecules, intermediate metabolic products are there. Fuel is high, acyl coenzyme is plentiful, and malonyl coenzyme is produced. Malonyl basically a appetite suppressant, Malonyl coenzyme inhibits acyl-carnitine transfer as well. So no fatty acids can get into mitochondria for oxidation when the fuel is high. Now this is how the transfer of coenzyme takes place. Now let me introduce the 4 steps in the elongation of fatty acids. Step 1 is basically the condensation, where loss of carbon dioxide drives reaction completion. All happens on enzyme complex. Step 2 is opposite of beta oxidation basically. This is synthesis of from acyl coenzyme A. Ultimately, palmitic acid is produced, which is 16 carbon fatty acid produced in synthesis complex. Elongation is possible with the enzyme. The organisms can make odd chain fatty acids, basically. The nomenclature of unsaturated fatty acid, omega-6 fatty acid, essential in human. This is called omega-3 and omega-6 fatty acids are essential. They are basically synthesized through arachidonic acid, and this is 3, where acyl coenzyme A, isopentyl cholesterol, and other molecules take participation in the synthesis. So ultimately, from acyl coenzyme A, isopentenyl diphosphate is formed, which leads to the effects of vitamin A, E, and K. And finally, the cholesterol is synthesized. And of course, cholesterol is basically required for testosterone synthesis, other estradiol synthesis, as well as basically synthesis for steroid hormones. Of course, 125 vitamin D3. This is a stage when weak clinicians come into picture, because most of the clinical manifestations, they take place because of deficiency of either one or more of the hormones or steroid pathway. Now, what are the medical applications of the cholesterol and its basically naturally occurring nutraceuticals? Statins inhibitor HMG-CoA synthase. The same enzyme is required for ketone body biosynthesis, but cholesterol is made in cytosol. Another strategy is to trap in intestine so that cholesterol is diverted. Basically, are the basic key sites where you can block the synthesis or the absorption of cholesterol inside the human body, and this is basically acting either in the gastrointestinal tract or somewhere maybe in the bile, or maybe at multiple sites. So far as the medical applications of these processes are concerned, there are a few parasites like malaria. They have isopentyl diphosphate through a different mechanism. A competitive inhibition can selectively kill the malaria parasite. This is how the mechanistic evaluation or biosynthetic pathway can enrich the knowledge of how to use the nutraceuticals or other available naturally occurring products. So to introduce nutraceuticals providing benefits, they can be used as therapeutic or prophylactic agents for a medical condition. They include isolated or assembled active food ingredients or a functional food, basically. Nutraceuticals are numerous in market. They have been suggested to improve plasma cholesterol, LDL cholesterol, and of course triglycerides, especially for hypercholesterolemic subjects, and used as adjuncts to most of the lipid lowering therapy. Minded, they can be used as adjuncts. It is hardly to support that medical evidence exists as of today that they can be utilized in isolation as a sole medical management tool for treating hypercholesteremic subjects. They possibly act simultaneously on many stages of lipid-induced vascular damage. They makes them potential candidates to improve lipid-lowering effects when used in combination with diet, drugs, or other nutraceuticals or lifestyle modification. They have large number of positive pleiotropic effects, including improvement of endothelial dysfunction, atrial stiffness, inflammatory and oxidative properties. Tolerability and safety of many nutraceuticals demonstrates lipid-lowering action, basically. And this is how we grade the recommendation in medical practice. Class 1 is of course recommended. Class 2 should be considered, and in class 2 A should be considered and B may be considered. Class 3 is not recommended. No efficacy on lipid profile is recommended, which is basically highlighted in red color. The level of evidence so far A, B, and C are considered. The data derived from multiple randomized clinical trials on the meta-analysis. B is data derived from single randomized clinical trial or large randomized trial. So far, we are concerned about nutraceuticals. There, they may be, given to patients with hypercholesterolemia, but there is, lack of, sound scientific multiple randomized control or at least a systematic review or meta-analysis that yet to be produced in medical fraternity for, as to use it as single agent. The clinical evidence on individual lipid-lowering nutraceuticals with lipid-lowering effects can be divided into three categories according to the mechanism of action. The natural inhibitors of intestinal cholesterol absorption, basically by these nutraceuticals, inhibitors of hepatic cholesterol synthesis by various enzymatic pathways, inhibition, enhancers of excretion of low-density lipoprotein cholesterol, and they can be basically divided into various components. The nutraceuticals can be plant sterols and stenols. They can be soluble fibers like psyllium, available quite probiotic basically, which we are using right and left in our clinical practice. Of course, they are available in prebiotics, but probiotics can be made, available to patients separately, even without that, mechanism takes place in the absorption of cholesterol. Basically, through exogenous cholesterol esters are produced, and they are ultimately made into solubilized micelles, and they are absorbed through chylomicrons. And if we go at gastric level, there can be increased gastric emptying time by soluble fibers, wherein you can slow or delay the absorption of these chylomicrons so that the body is not basically the cholesterols. Of course, the cholesterol can precipitate in the gut by various nutraceuticals like bergamot, berberine, and polycosanols and psyllium, etc., and other soluble fibers, of course. Plant sterols or stenols can, lead to precipitation of these cholesterol, which are being ingested from outside. That is exogenous cholesterol. Or curcumin, which is very important, ingredient in our daily food habits, that is haldi. But the point here to note is curcumin that we consume in, as a ingredient, as in the form of spices, is not at all, insufficient amount to block this cholesterol ester production. It needs to be consumed much higher concentration, and of course, the purity of curcumin needs to be seen. And there are certain specific variety of curcumin which are usually found in hilly areas, which are found to be very effective in reducing the cholesterol levels through reduction in the cholesterol ester formation. Now, of course, there could be inhibition of the formation of cholesterol ester, that is called ACAT inhibition, through artichoke, bergamot, plant stenols, and stenols. And the nutraceuticals which work on bile acids or bile salts basically are berberine and psyllium, probiotics, and soluble fibers. So here we can see that soluble fibers are working at multiple points. So multiple targets are there. So there is no harm in advising the patient for soluble fibers to take in plenty, and they are very easily available in seasonal fruits. If we just ask the patient to take fruits, there will be enough amount of soluble fibers that can be delivered to the patient. And of course, the complex carbohydrates, they can also reduce the absorption of cholesterol and can have its effects at multiple positions. So this is how your nutraceutical can fix the cholesterol synthesis as well as its harmful effects on the body. Now, nutraceuticals acting as inhibitors of liver cholesterol synthesis are found in red yeast, white extract, garlic, antithine, bergamot, and polycosanols. So garlic is a very effective modality of inhibiting the cholesterol synthesis. But one thing is very important, that people use ginger and garlic very commonly in huge amounts. It should be kept in mind that ginger has a antiplatelet action. So the moment any person complains, especially having cardiovascular disease and taking aspirin simultaneously, he can have increased, propensity for bleeding maybe. That needs to be told to the patient. So this is a diagram of how nutraceuticals act on liver cholesterol synthesis, and these are the targets like bergamot inhibits HMG-CoA, green tea, monocolinols and pantethine, silymarin and vitamin E, basically active on reduction in the activity of HMG-CoA and hence cholesterol synthesis. Of course, berberine is also active in reducing the bile salts and other products. So curcumin and berberine has multiple other site of action. So they can be very well used in the clearance of LDL basically through more formation of LDL receptors in the liver. This is also enhanced by silymarin and soy. So soy protein is quite good, and this is available in many forms. Right now, this is available in nuts form or maybe in the form of paneer and other forms. So soya can be taken, and it has very good effect as a natural nutraceuticals. So this is the level of indications, level of scientific evidence. Like say for example, red yeast, right extract, class 1A indication is there. Okay, for garlic 2A, pantethine 2A, 2B, and so on. So what is strongly recommended? I mean, you can recommend this patient to take red yeast extract, garlic, and pantethine maybe. But of course, fibers, soluble fibers are acting at multiple sites, so there is no harm in providing the beneficial effects of soluble fibers to every single patient who is having diabetes with dyslipidemia or otherwise coronary disease or hyperlipidemia and hypertension, basically as a preventive tool to reduce the future coronary events. Nutraceutical acting on fatty acids as on uh, yeah, so they are basically berberine, green tea extract, soy, and proteins. So this is how the fatty acids are being targeted by these nutraceuticals. Say for example, bergamot and polycosanols, omega-3 fatty acids, to increase beta oxidation and reduce the synthesis of acyl coenzyme and fatty acids through cyclic AMPK activation. Similarly, there can be increased beta cell oxidation and synthesis of fatty acids and triglyceride acyl coenzyme A, mitochondria, transporter of fatty acid to L-carnitine basically. So they can be activate fatty acids, can be activate mitochondria for utilizing these fatty acids. So reduced production and better utilization of fatty acids takes place in the form of energy, efficient manner. Nutraceuticals acting on fatty acid as in LDL cholesterol excretion. Yes, level A indication exists, but for reduction in the apolipoprotein B, triglyceride, HSCRP reduction, IL-6, and home iron reduction in the index of home iron and blood pressure reduction. Direct vascular effect is of course demonstrated, but expected effect on LDL cholesterol, approximately 15 to 20% reduction in LDL cholesterol is documented in the dosage of 500 to 1500 milligrams per day by berberine. And what about the green tea extract? Of course, if active daily dosage of 25 to 100 grams are taken, there is reduction in the blood pressure, expected reduction in the lipid lowering LDL, and of course there is direct vascular effect. Potential benefit effect, the direct vascular effects are there. Now class 2 B, yes, of course, in 5 to 100 gram dosage, of LDL cholesterol is approximately approximately 10%. Effect on CV risk biomarkers are not demonstrated yet, but yes, with soy and isoflavonols, direct vascular effects noted with soy and other proteins. Polyunsaturated omega-3 fatty acids, they are no doubt, everybody knows that they are very useful, and we do use in patients with coronary disease, with dyslipidemia. Orazonol has no direct vascular effects, but yes, it is recommended in the dosage of 300 milligram to reduce the LDL cholesterol by 10% and has its own direct CV biomarkers, and biomarkers are also reduced. Spirulina, yes, there is no direct vascular effect, but of course there is reduction in triglycerides and increase in HDL cholesterol. In the dosage of 400 to 800 international unit can be used. Level of population is 3, class is 2A. Curcumin is 2A. Yes, there is, ubiquitous. This is having beneficial effect in all the components of LDL cholesterol reduction. So this is what I have shown you. Active daily dosage is 1 to 3 gram. So 1 to 3 gram basically can be obtained from a higher amount of consuming haldi, basically, not the typical amount that we use in our daily cooking. That curcumin should ideally be that we are using as adjunct or additive to the milk is quite helpful in reducing the inflammatory biomarkers, reducing the triglycerides, and HbA1c reduction, and of course a HOMA index. So level of scientific evidence is B, and class is 2A. L-carnitine, no direct effect on vascular effect. Similarly, Senera, artichoke, there is no direct vascular effect, but of course there is effect in lipid lowering as well as LDL lowering effect. But you can infer from the lipid lowering effect that it is as good as any low dose statins, basically. So those patients who have not got any coronary event, yes, they can be prevented to have it by recommending this. So this is class 3. I'm not going to discuss like silymarin and conjugated linoleic acid. That yeast rice and polycosanols are both class 1 and level A indication, though they are used basically as red yeast rice and berberine. They have both direct vascular effect, cardiovascular benefits are there. Expected LDL cholesterol lowering is approximately 25%, which is quite a good amount of cholesterol lowering propensity with this red yeast rice. Active daily dose is approximately 300 milligram of monocol, and polycosanol is 10 milligram, and berberine is approximately 500 milligram. So this is level 2A, class 2A indication, and level B indication. Say for example, red yeast rice. So what we can learn that red yeast rice is good. So I just go to my previous slide. So you can see that approximately 25% reduction in the LDL cholesterol is there with red yeast rice and berberine. So they are worth using the moment we want to consider lowering the LDL cholesterol. So there are other benefits of red yeast rice and antioxidants. Now coming to berberine combined with bioactive lipid lowering agents other than red yeast rice. So here we can see that direct vascular effect is still not seen, but of course there is a reduction in the triglyceride level as well as HOMA index, and approximately similar amount of lipid lowering effect is seen so far as LDL cholesterol is considered. So this alone, or maybe used with other components, say for example red rice yeast along with berberine, maybe combined, may not be combined. Yes, you can use it all alone also. Soy protein, which is very easily available in markets, and plant sterols, they have a huge propensity of reducing the LDL cholesterol up to 30%. It has been seen. Soy protein in the dosage of 8 to 25 grams. What I recommended my family members that every day in the morning we have the soy protein in our in a breakfast every day morning. And this is especially useful for very strict vegetarians, which is they're consuming very low source of proteins, very low protein intake. So this soy protein can supplement both the protein as well as the nutraceuticals, and of course helpful in reducing the inflammatory biomarkers for cardiovascular disease like protein B and other biomarkers like HSCRP. So of course it can be made a very important daily ingredient of your diet. Any diet you can choose, and every day serve at least 25 to 50 grams of soy in any form, whatever you like. This is also available in the form of very fine chopped one, where you can mix it with atta and make chapati also, make paratha also. If the children are not liking it or it's not palatable to them, you can make biscuits also. So there are many ways by which you can use the soy protein, and I am a very strong proponent of using this soy protein in very heavy manner, maybe in the sort of paneer, which is available in the form of tofu. Market preparations, basically available in various flavors, like this is available in with the spices as well as blend. So you can choose any of them, and you please start recommending to yourself as well, apart from the patients. So this is a nutraceutical combination, efficacy, and recommended in condition and the safety. So there is no safety concern because most of them are already being used in one or the other form. The red yeast, rice, and omega-3 polyunsaturated fatty acids efficacy in lipid level lowering is approximately 75%. And the problem is basically the efficacy with the rice, bitter gourd, chlorella, soy protein, and licorice. Sometimes you may not have a good efficacy. But of course, the anti-inflammatory effect as well as LDL cholesterol reducing potential of all these nutraceuticals is varying between somewhere from 12.5% to 25%, even to 30%. So they can be very well utilized in your daily diet. So this is a lot of data which I am putting forward, but I am just conveying the message of these nutraceutical combination with statins. Say for example, statins and polyunsaturated fatty acids, efficacy approximately 19%. Statins and soluble fibers approximately 31%. Azithromycin, red yeast, licorice, polycosanol, and berberine approximately 37%. And maximum is seen with statin, azithromycin, and plant sterols. As we know that azithromycin itself is a inhibitor of this absorption of these lipids. So of course the quantum needs to be high, and it is there. The statins and bergamot, so 53% and 37% reduction in oxidative stress. So this is having a very good additive effect when the patient is already taking the lipid lowering agents in the form of secondary prevention. But mind it can be used as primary prevention when the patient has not any coronary event, only isolated diabetes or maybe hypercholesterolemia, which of course is not very dangerous, and in metabolic syndrome and hypertension patients. The take-home message is large number of trials demonstrates nutraceuticals have lipid-lowering effects. Nutraceuticals cannot replace lipid-lowering therapy. This needs to be borne always in mind. So we need not take off the patient from your lipid-lowering agents. Important for patients with mixed dyslipidemia, mainly atherogenic dyslipidemia in patients with diabetes and metabolic syndrome, in patients with low to moderate hypercholesterolemia, as well as in all patients with statin-associated side effects. So you can, have an additive role in HMG-CoA reductase inhibitor or maybe any other form of lipid-lowering therapy. Improve some markers of vascular aging like endothelial function, pulse wave velocity. Some nutraceuticals significantly improve efficacy of a standard pharmacological treatment. An evidence-based approach to use the lipid-lowering nutraceuticals could improve quality of treatment, including therapy adherence and achievement of LDL cholesterol in clinical practice. So my take-home message to all my doctors, colleagues, and their families is you please incorporate one of them in your daily diet and see the effect, and you really like it, and recommend this to your patients, of course, who are having high propensity or predilection for cardiac events, or so they are both recommended for primary and in addition to lipid lowering agent to secondary and tertiary prevention. Main concern is still which lipid lowering effect of nutraceuticals is clinically relevant, maintain in long term, and be associated with an improvement of cardiovascular disease. Combinations of lipid lowering nutraceuticals could improve their safety, but there is no data yet exists that says that yes, you can combine 2 or 3. Both single components combination can be used, but it's up to you. Choose wisely, and the one which is cost effective. And to my opinion, soy protein is one of the best that can be incorporated by any single individual in his dietary form, that can benefit in multiple ways. And of course, soluble fibers which are freely available can be utilized, and omega-3 fatty acids are a big promise in lowering the lipid in any single individual. With this, I thank you all very much for your patient listening. If there is any question, any doubt, I know this is more of a biochemical or biochemistry sort of presentation, but of course for clinicians there is a catch that you can use it, of course. Thank you all very much.
Thank you, Dr. Ravikaant. That was a nice presentation.
Thank you.
Basic concepts of the other was talking about a particular diet which we can incorporate in our day-to-day life so as to have a lipid lowering effect. A
Yeah,
few things which comes to my mind, that definitely you have very much specified that statins has its own place and that cannot be replaced with nutraceuticals. But
exactly.
in older days there was something called Bejhad ka atta, or what we nowadays call fancy thing as 5-grain wheat,
Yeah.
5-grain atta.
Yes, yes.
So would you like to talk something about what is the role of, is there any role of 5-grain thing in lipid lowering effect as nutraceuticals?
Okay, let me go into a little depth of nutrition basically, which is of course my area of interest as well. So what we want from our meal? Basically, we want some instant energy. Number two, a delayed or controlled release of energy, right? So what we Indians do, we are approximately, our diet consists of 80% carbohydrate and very little amount of proteins. So Indians are by and large deficient in proteins. So what is happening basically, there are certain aspects of nutrition. So for example, the gastric emptying of carbohydrates is only 4 hours. So the moment you take a lot of carbohydrate, after 4 or 5 hours, there will be appetite. So again, the individual will have meal. So how to reduce the appetite of a single individual, how to control the energy release, and how to give a constant energy supplementation to these individuals. The whole idea is you have the proteins in the breakfast. Say for example, if it is a non-vegetarian or vegetarian, they can on daily basis take eggs. Eggs has a good gastric emptying time. They can last for 4 to 6 hours. So there will not be any surge of appetite after 4 hours. And second, the carbohydrate which we are taking basically in diet can bind to these molecules, say for example proteins or other complex fibers. So the release of the carbohydrate is reduced and it is controlled and steady rate. So the basic concept of 5-grain atta or multi-grain atta has come from the sources wherein you are adding basically the fiber component as well as different ingredients. So for example, one food item, say for example you are adding the chana or the grams to wheat. Basically you are adding protein to carbohydrate that will reduce the absorption of carbohydrate as well as it will give a constant supply of proteins. That way the appetite will be reduced, absorption of carbohydrate will be reduced, and of course they will also reduce the absorption of lipids. So this is seen the moment you supplement your diet with multiple nutrients of say for example fixed proportion which is required. Mainly proteins in the breakfast is a major important aspect for reducing the weight, for reducing the appetite, reducing the inflammatory markers. So there is always a scientific evidence of combining 3, 4, 5 ingredients in the same. What I recommend, if you take something called a dalia with maybe some sort of other ingredients in the form of proteins, say for example grams or some other form of protein. This is a very good diet basically. So I do see that multigrain atta has a role, but what is important, it should be person specific. It's not that the market available atta is good, not at all. Say for example, if we see the composition of the market preparations, they may not have adequate information in view of varying prices for different ingredients. So I believe that you have to make your own atta in your proportions. Some persons can use this. I personally use in my family the soybean, the ragi, or the wheat that I use, and chana, of course. These four components I do mix them, and what I have seen that this is quite helpful in many ways. So over to Dr.
Very
Jagani.
true. Very